Now, from a loving husband of 15 years and a father of 4 to a spiraling cycle of abuse leading to divorce and even nearly death, a malignant brain tumour could have been the cause of his personality changes. Surgery eventually saved this man's life and his marriage, but even then, the battle against cancer isn't over for Sadayan Maideen. For more and to unpack the science behind this story, we're joined by his doctor, clinical associate professor Tseng. Tsai. He is the head and senior consultant at neurosurgery at NUH. Welcome, Professor Yo. Now, first, I wanted to ask you exactly what is glioblastoma and how rare is it?
It's a relatively rare tumor with an occurrence about maybe 3 per 100,000 population. Yeah. But it's unfortunately a very malignant brain tumor. In fact, it's the commonest primary malignant brain tumor. And the median survival in general is roughly about 18 to 24 months.
Right. I also want to know a bit about the symptoms and how it presents itself in Mr. Sadayan in particular.
I think in general, most glioblastomas present with raised symptoms of raised intracranial pressure or focal motor deficits. So for Mr. Sadayan, he's quite unusual in the sense that the very strategic location of this tumor in a part of the brain called the amygdala, which is the emotional part of the brain. So he presented as behavioral change. And so he was actually both verbally and physically abusive to his family. Yeah. And I think the causative factor was this tumor that was situated in his left amygdala.
What helped you then zero in that it was this, as opposed to something else, as you have just mentioned? All these symptoms can mimic so many other things.
Yeah, so I think for him, he also had epilepsy. Yeah, so this part of the brain is well known to be very epileptogenic. So we had to do surgery to remove this lesion, this tumor anyway. Yeah, and based on his history, his presentation, I think it all tied in very classically that this was the cause of his symptoms and his behavioral change. So I was actually quite certain that once we remove this tumor, there's a reasonable chance that all this would change and he would sort of become good again. And that turned out to be fortunately true for him. Yeah.
Well, before he got good again, I know that this sort of surgery is very risky. So can you share some of the challenges that you faced when you were trying to remove the glioblastomas?
I think in general, it's almost impossible to remove glioblastomas totally, but we do our best to remove the most we can safely without damaging parts of the brain that are in the vicinity. So in Mr. Sadayan's case, it was very close by the hippocampus as well. So in a right-handed patient, the left hippocampus is responsible for verbal memory. So we had to make sure that we didn't damage his verbal memory too much as well. So we had to be a bit conservative in the resection of the left hippocampus. But sometimes it's a bit of a trade-off. So you really sometimes have to go and remove as much tumor as you can, and at the expense of some, hopefully just a fairly minor neurological deficit. So yeah, it was a challenge removing a tumor for him, but I think he came through with flying colours and has done exceedingly well, and we're really happy with the outcome.
But it's not over yet, Professor Yo, is it? Because he's had those operations, but I believe that he still needs to. The battle still continues for him.
Yes, so like I said, even the best surgeon in the world can't remove all of a glioblastoma. So it's standard of care now that after the surgery, patients with glioblastoma have to undergo what we call a STU protocol, which is a chemoradiation therapy. Yeah. And so this is what Mr. Sadayan also underwent, and actually he's still on chemo. He's completed his course of radiotherapy, but he's still on chemotherapy.
Yeah, so also we wanted to touch on perhaps support for caregivers as well when it comes to supporting patients and themselves through this process. Get you in another time for that, Professor. We've been speaking with the Clinical Associate Professor Tseng. He is the Head and Senior Consultant of Neurosurgery at NUH.